prevention control are essential. 4 points as suggestions. First, the meeting room should be well ventilated. As weather gets warmer, we suggest ventilation by opening the windows. If a centralized air conditioner is used, we suggest the use of free air. Maximize the ventilation volume of the fresh air inflow to ensure the freshness of air. Second, prior to the meeting and after the meeting, the table surfaces, the arms of the chairs, and the surfaces of the ground of the meeting room should be disinfected and cleaned. Third, minimize the frequency of the meetings and shorten the duration of each meeting. Distance the participants to the meeting, and participants should wear masks. Fourth, if a video conference is possible or a WeChat conference is possible, we suggest a replacement with the physical meeting. Thank you. Thank you. Last 2 questions. Journalist from the 5th row on the right side, please. From 健康报 JKB. In Baodi of Tianjin, there was a shopping mall which experienced a cluster case. So in places like supermarkets and shopping malls, can the public go to places? What are the corners that we should pay special attention to? What are the measures adopted on the centralized air conditioning system? I'd like to ask researcher Zhang Liubo to take the question. Again, this is a lively discussed question because shopping malls and supermarkets have a close bearing with the daily life of the general public. When people are asking, can supermarkets and shopping malls be opened? My answer is they must be opened to meet the needs of the general public. They have to be opened for consumers and customers. You are suggested to minimize the frequency of supermarket and shopping mall visits. If you have to go, then shorten the time. You have to shop the daily necessities. And you are not suggested to do a random shopping. As a journalist has asked questions on the key places and points, like the lifts, the air conditioning system, what should be the disinfection and the cleansing efforts be carried out? I've prepared a list, and I think not only places, as you've mentioned, there are other places that we should pay special attention to. First, for the escalator lifts and the lifts, the ground surface, the buttons, and also the arms of the escalators should be disinfected more frequently. The counters should also be frequently disinfected. Second, for the central air conditioning system, we know supermarkets are usually spacious. So being it of a fan coil system or a free air system, we suggest the use of a free air system to the maximum. If free air handling is not possible, then we suggest physical ventilation by opening the doors or windows. Third,
I think which is more critical or crucial even, that is
to set up a health declaration system and also body temperature monitoring system to identify the abnormalities among the staff and also for the customers. We need to have early detection of the abnormalities. And fourthly, in shopping, there should be a certain distance kept. The farther, the better. I think at least 1 meter. Whether you are at the cashiers or you are weighing the products you are buying, there should be at least 1 meter distance kept apart. And also try to use the NFC approach to have the electronic account settlement, and also emphasize the hand hygiene. And seventhly, if you find any suspicious signs like abnormalities in body temperature, then you should report to the local CDC and have their guidance to have the environmental disinfection. Last question. On the left, on the 5th row, the third lady reporter. Thank you. From CETV. Recently, localities in China are recovering their business or operations, and kindergartens are also planning to reopen. So what are the protection measures for the kindergartens? Professor Zhang, please. Indeed, people are quite concerned about the safety in the kindergartens or the nurseries. I think there are 3 aspects. First, before the reopening, the kindergartens should have a thorough disinfection and cleaning. It must be ensured the freshness of air indoors and also the adequate supply of the protection materials. And the staff working in the kindergartens should be well educated and well trained to use the materials. And the second, to have the baseline information collected concerning the teachers and the kids. And secondly, once the kindergarten opens, if the epidemic is over, then we can just follow the routine procedures. But if there are still cases identified, then there should be precautions adopted. There should be emergency response plans developed and put in place. Also, there should be disinfection concerning the goods and products used, as well as hand hygiene. Apart from that, thirdly, in case of suspicious cases or suspected cases, then we must follow the emergency response plan to deal with such suspected cases. Thank you. So that's all for today's Q&A. May I now invite our expert to teach us some health knowledge. Professor Shi, please. Thank you. Recently, some netizens discussed that when businesses restart or the supermarkets reopen, what to do to ensure the safety. Let me try to answer this question. Indeed, in waiting in the lines for the supermarkets or for the restaurants, we need to wear masks and reduce unnecessary verbal conversation, and also try to keep a safe distance away from others. Also, when you are in line, if you need to cough or sneeze, use the paper handkerchiefs or paper tissues
the tissue papers to cover your mouth and nose, or use your elbow. Also, when you pay at the cashier, try to use the QR code or the NFC approach. Try to reduce the use of cash. And secondly, in going to the restaurants, try to use the clean tables and the chairs, especially those close to the window where the air is fresh. Also, use the running water to wash your hands or use the hand sanitizers. During eating or dining, when you take off the mask, make sure that the inside of the mask is kept clean and avoid the face-to-face sitting. It is suggested to sit towards the same direction and also keep some distance away from other diners. Also try to reduce the communication during the eating process, and also you can have takeaways. This is a very good choice, and try to minimize the time when you are staying in the restaurants or in the dining halls. The second question is, during the epidemic, the public should refrain from unnecessary outgoings. But if you have to go to the supermarkets or the shops to buy daily necessities, how to protect yourself? Well, for this question, I think it is quite important to have good self-protection when you go to the supermarkets or the shops. You need to pay attention to the following 4 things. First, try to avoid the peak hours or the busy hours. For example, you may choose to go to the supermarkets in the morning or during the working hours, so as to minimize the exposure to crowded places. And the second, if you have to take a lift, if you go to a shop or a supermarket at lower floors, I suggest you to take the stairs. But if you have to take a lift, try to use the escalator instead of the lifts. And if you find the lift is very busy, wait until the next one. And also wear the mask and keep a safe distance away from others. Thirdly and fourthly, in all locations or places, you should wear the mask in the whole process and keep clean your hands, or good hand hygiene. Thank you. Thank you to the speakers, and today's press conference reviews the things that we should pay attention to in public places. I think we have also broken a record because today we took 15 questions. So thank you very much for your interest in our press conference. And for tomorrow's press conference, we will talk about the taxation and the financial policy support for the work resumption. And we welcome your questions, and your questions are also always welcome to be sent to our mailboxes. That's all for today's conference. Thank you.
回头再联系。117。